You might be breathing in mold every day and not even realize it. And that's a problem, because the air in your home or workplace could be making you sick. This isn't the kind of mold you wipe off the bathroom tile. I'm talking about toxic mold, hidden behind walls, in air ducts, under carpet, and in places you'd never even think to look. The worst part is most people have no idea it's affecting them. When mold releases these toxins called mycotoxins, they don't always trigger the obvious signs of sneezing or watery eyes. Instead, they take over your immune system, causing your body to react to them constantly. That reaction creates long-term inflammation, something called chronic inflammatory response syndrome. And once that fire gets going, it doesn't stay in one place. It spreads. People start experiencing things that seem totally unrelated, like memory issues, rashes, and abdominal pain. This is where it gets really frustrating, because when patients go to their doctors, all the usual tests come back normal. They're told it's just anxiety or burnout or stress. Meanwhile, their body is being poisoned by something in their own home or workplace, and no one's looking for it. Let me tell you about a patient I had. Let's just call her Amanda. She was around 40 years old, a social worker. She came to me with a list of symptoms that didn't add up. She was exhausted every day, mentally foggy, muscle pains, and she felt like she was falling apart. She said that it felt like her body aged 10 years in just one. She thought maybe it was early menopause or stress from work. Her primary doctor had run blood work tests, a chest x-ray, hormone panels, and everything looked fine. She was told to rest and maybe talk to a therapist. But I asked her a question she hadn't heard before. Had there ever been water damage in your home? She said that there was a ceiling leak a few years ago, and it still smelled strange in that corner of the apartment. I tested her for mold toxins, and her results were some of the highest I've ever seen. Her inflammatory markers were elevated too, and when her apartment was properly inspected, they found black mold growing behind the drywall, exactly where the leak had been. Once the mold source was removed, we started her on a detox program to help her body eliminate the toxins. It took a few months, but her symptoms didn't just improve, they started disappearing. Here's what people don't realize. Not everyone reacts to mold the same way. You could have two people living in the same house. One person feels completely wiped out while the other feels fine, all because of how each of their bodies handles mold. Some people have genetic traits that make it harder for their immune system to process mold toxins. So when they're exposed, the toxins stay in their body longer and the inflammation never shuts off. Why is mold toxicity so often missed? It doesn't show up in routine labs, and doctors aren't trained to look for it. It doesn't have clear or specific signs either. Mold toxicity mimics other conditions like chronic fatigue, fibromyalgia, and hormone disorders. So people are sent home with prescriptions that mask symptoms, but never get to the root cause. And it's not their fault. Most physicians aren't taught environmental medicine. They're trained to look for diseases that fit a specific set of lab results. But mold toxicity doesn't show up the way most doctors are trained to look. You have to ask the right questions and dig deeper. If any of this sounds familiar, if you've been told it's just stress or burnout or just getting older, don't ignore your gut feeling. Your environment could be playing a much bigger role. Start by investigating your living and work spaces. I'm not talking about checking for visible spots on the wall. I mean a real inspection. You need someone who knows how to test inside your walls, under floors, in the air, and especially inside your HVAC system. Mold doesn't always grow where you can see it, and some of the most dangerous kinds often don't smell at all. If mold is found, you need to remove the source completely, because if you only clean the surface or spray something over it, it will come back, along with your symptoms. And detox isn't as simple as taking a pill. It needs to be tailored to your body. That usually means supporting your liver, your gut, and your immune system. Some people also need antifungals, anti-inflammatories, or hormone support, depending on how deeply the mold has affected them. The process takes time, but the results are worth it. Once you've removed the source, treatment is all about helping your body eliminate the toxins that built up while you were exposed. This isn't a one-size-fits-all approach, and it doesn't happen overnight. It usually starts with binders, compounds that latch onto toxins in your gut and help carry them out of your body. Common options include activated charcoal, bentonite clay, or prescription binders like cholestyramine. From there, depending on the type of mold toxins, you can support the liver with nutrients like glutathione, NAC, and vitamin C because your liver is doing a lot of the heavy lifting. If mold has grown in your sinuses or gut, you might need antifungal meds or herbs to get rid of it, depending on how deep it's gotten. We focus on repairing your body so it can recover properly, and we replace nutrients that mold often drains, like magnesium, B vitamins, and zinc. And throughout all of this, we keep monitoring symptoms. It's a step-by-step process. but with the right protocol and clean environment, people get better. I've seen mold toxicity ruin people's health, careers, even their relationships. But I've also seen people fully recover once they identify the source and take action. So if you've been struggling with any of the issues I talked about in this video and no one has given you a clear answer, look into mold. It's more common than people think and far more destructive than most doctors realize. If this video taught you something new, consider subscribing, because we post informational health videos just like this. And remember, this isn't medical advice. If you've been wondering about other hidden issues, watch the video on your screen now to learn about 17 signs you might have hypothyroidism.